Good morning. This is Dr. Dale's Natural Health Radio. This is Dr. Teresa Dale. We have an amazing show for you today, and we are going to bring Laura Dankoff to you. She's a RN, and she has been working in the natural field for many years. And we want to talk about your gut today. We want to talk about your digestion, your microbiome, and all the things you've heard about that's new about the gut, and some things that have been around for a long time, yet people seem to not know about them. So we really want to educate you today about your gut, about your digestion, about your small intestines, your large intestines, and how they can function better. And I think that the majority of people in the world need to know this. So for those of you who don't know, you can read more about my radio show, the Natural Health Radio, and about me on wellnesscenter.net. If you are interested in our trainings, that can be found at traditionalnaturopathy.com. We have a new website that is pretty. It's really pretty. And this website, we've been working on it for about a year, and it's finally done. And our trainings are the same. They're awesome, and they prepare you to have a new career or to expand your existing career in natural medicine. So we welcome you to go to Natural Health Radio to check out also our other shows from the past. You can find those on my website as well as iHeartRadio. So we welcome you today. I can see that you're filing in. Remember, I have some questions from last week that I want to go over with you and make sure I answer those questions. And we have a guest today. So we want to welcome Laura Dankoff to the show. Laura, are you there?
Yes, I am. Thanks for having me on today.
You bet. So I want to, first of all, thank you for being on and being a guest. So I know that you're working with the gut as well as every other thing, but we want to talk today specifically about gut issues. Tell me what you find most prevalent in the world today, or in your town, or wherever you working, and what you're finding is the most important thing.
Sure. Well, I've been working as a nurse practitioner for over 11 years now, and in that time, my focus has always been on trying to help people find natural ways to improve their health without resorting to a pill for every ill. And during that time, it became very apparent to me that if you don't heal the gut, you're going to have a hard time correcting other imbalances in the body. Initially, I had a lot of women coming to me for their menopause symptoms, and in the process of trying to help them with their hormones, I quickly found out unless we work on lifestyle factors and improving their gut health, that the results that they were going to get were not going to be as good. I would say on average they saw maybe about a 30% improvement with continued bad eating habits, lifestyle, with just supporting them with a few nutrients. But that still oftentimes was definitely not effective if they did not take their diet seriously. But even if they were eating healthy, then we still could find problems with their gut health that was impacting their hormone balance as well. So I think, as you well know, over the last probably 30 years, our environment has been greatly adulterated with a lot of chemicals and additives and preservatives and foods and sugars and so forth. And in time, those things are going to definitely have a detrimental effect on your intestinal health or your digestion. And it will create a lot of inflammation. And a lot of times people will say, well, I don't have any gut issues. I eat just fine. But yet they're complaining of fatigue and brain fog and joint pain and headaches and depression and what have you, and they would in no way think that it had anything to do with their digestion.
Isn't that amazing? Isn't that amazing, Laura, that people overlook the most simple things? And so what do you suggest related to gut health as far as diet that will help people, listeners today?
Mm-hmm. Well, usually the first thing I always tell them is eat real food. and
right.
Sometimes they don't know what real food is. And it means one ingredient. And it ideally organic as possible. So that means an apple's an apple, almonds are almonds, and avocado's an avocado. You know, you go to the store today, you pick up anything that isn't in the outside aisles, so to speak, which is your fruits and vegetables and nuts and seeds and so forth, then that's where you run into the problems of getting exposed to things that your body can't digest or can't handle, or creates an inflammatory response in the body. So that is the first place to start. So they need to kind of clean out the pantry. There really shouldn't be too much in the pantry. You should have a lot in the fridge, you know, with your fresh fruits and vegetables.
So what kind of things should they avoid? I know you said to stay to the outer aisles, which is your vegetables and your fresh fruit and all of those kinds of things. But if some people right now are wanting a little bit more information on that, can you be more specific?
On what to avoid, yeah. So sugar. Dairy is very inflammatory for a lot of people. They cannot digest the proteins well, and plus it's adulterated with a lot of, you know, hormones and what have you. Gluten is a huge problem, and it's not just a fad problem. It really, people have trouble digesting the protein, the gluten protein, but part of it has to do with how the grains are harvested and raised, and those create inflammatory reactions in the body. So gluten is basically primarily wheat, rye, barley. Some say oats. I think the oats kind of depends on how they're processed.
Exactly.
You know, you want a gluten-free oat if you're going to do that. So some people, you know, definitely soy. Soy's one of those things that's been genetically modified and can be a problem unless you're getting organic, like edamame and things like that. But some people don't handle even nuts or seeds sometimes. So what I'll have them do is maybe you start an elimination diet. Some people will go all in and take out gluten, dairy, soy, eggs, corn. Those are the biggies, and do a food elimination. Other people, that's just too overwhelming, so you start with one thing. You know, pick one of those and start there and just try to start building upon that. And usually I'll tell a person to take that out for 2 to 3 weeks at least. In that amount of time, if you notice anything improving, any symptom that you're having, even how slight you maybe dismissed it as, oh, I'm just getting older or what have you, and you're noticing improvement in those symptoms, that is an indication that you very well are sensitive to that food and are reacting to it, and it's inflammatory to you.
Right. Now,
so that would be one good place to start.
Right. I agree with that in totality. What about the microbiome? Are you working with that in any way?
Yeah, I mean, there's different tests out there that you can do. Some of the newer tests, and there's even controversy or discrepancy if you talk to one like health practitioner to the next, you know, in the functional medicine community in particular, on whether or not those tests are worth doing or not. There's one called GI Map and Ubiome and Biome. So there's several different ones. But if you do not have, so your microbiome is basically your good versus bad bacteria balance in your intestinal tract.
And that has been around for a long time, hasn't it? And now they put a new name on
forever.
it. Yeah, they put a new name on it to make a product, to make money for the product, But the microbiome is just the gut, the balance of the gut bacteria, It used to be called the milieu of the body. I mean, there's many different ways to describe things, and I think it's very good for anyone listening who wants to go to a health provider. Whenever they mention a name you're not familiar with, if you ask them to describe what they're talking about so that you have a good idea of what they mean. And I think once you understand, like the microbiome, it's the good bacteria versus the bad bacteria, right?
Correct. So we obviously want more good bacteria than bad, but unfortunately a lot of people have more bad than good. And when that happens, it creates an increased intestinal permeability as well. So with that inflammation going on, it can lower the immune system in the gut. It can allow things like bad bacteria and endotoxins and parasites and yeast and food sensitivities and all these things to develop. So one of the things that feeds a healthy microbiome is to make sure that you're getting back to the real food again, organic real food, making sure you're getting plenty of fiber, because the fiber helps feed the good microbiome or good bacteria in your gut. Good prebiotic foods. This would be things like artichokes and garlic and onion and bananas and, just healthy fibers. And some people have a hard time digesting like raw vegetables. So if they do, I'll have them lightly steam them. Or that might be a time, initially where somebody might have to do some juicing just in order for them to be able to handle the amount of, they can't handle the bulk fiber sometimes. So sometimes it's trying to ease into that, and as their gut heals, they may be more apt to handle that. Another thing that kind of goes in hand with that is that they have adequate digestive enzymes. So when we chew our food, which people tend to eat too fast and not eat mindfully, then when they're eating too rapidly, they're not making enough of that enzyme just starting even in the mouth, and then it's got to go to the stomach, and you have to have enough hydrochloric acid and so forth there, and the pancreas and liver. All those things are releasing these enzymes to aid digestion, but when people's bodies are inflamed or they're eating poorly or they're eating fast, you're not giving your body time to produce those enzymes to aid the whole digestive process.
Right, and I think this is such good information, and we talked already. I'm just going to repeat a little bit for those of you who are just tuning in, and I could see some of you, that we're talking about the gut, and we're talking about having more good bacteria than bad bacteria, and that oftentimes is called the microbiome. And there are tests to determine this, but I feel that you don't really need a test, that you should be living a lifestyle with enough foods that will help you to create more good bacteria than bad bacteria. And one of the things that Laura was mentioning was to make sure that you eat whole, natural foods, non-GMO, organic, and that you just, that would be eliminating maybe some canned foods or frozen foods that are mixed with a lot of things you don't really know. It's a mystery frozen bag of schmutz, as I call it. It's like, oh, here's some more of this stuff, and sometimes you buy frozen peas that are called California-style peas that are from China. I've seen it on the bags in the frozen food. So the best thing is just to make your life simple. Buy the fresh organic food, right? So,
right.
And Laura, how do you feel this is involved with people's emotions, or should I say, how are their emotions have you seen emotions affect their physical reality, their physical health?
Oh, absolutely. I mean, when you're talking about the gut and the microbiome in particular, we all know there's an epidemic of mental illness in this country, and nobody's thinking that gut health may have anything to do with it. But in reality, is a large proportion of your serotonin produced in your gut, and so serotonin is kind of what helps your mood stay even. It can affect your sleep. It can affect your overall sense of well-being. Not only that, when you eat food, you're getting amino acids and vitamins, and so B vitamins plus amino acids equal healthy mental health. So when you aren't absorbing those or ingesting them regularly in your diet, it is bound to have an impact on your mental health. Brain fog, fatigue, anxiety, depression. We know that there's a correlation with some of these sugars and additives with attention deficit disorder. That was brought out probably, 12 to 15 years ago. But, is anybody talking about that when kids go to their pediatrician or their child psychiatrist? Are they talking to them about their nutrition and diet with the parents? I don't know. I think they're, I could be wrong, but they're probably just trying to decide what drug they're going to give them to keep them, attentive in school. So.
And you know all about that because you've worked with a lot of medical doctors in the past, and you've been in that traditional model as well as into the natural model. So you really can verify this by seeing it. I see it on a regular basis. Or have, unfortunately. I recall several years ago I was working in internal medicine, which was adults, but this mother had asked me if I would see her daughter, and she was, I think, 15 at the time. And her daughter was completely lethargic and could not make eye contact and was not interactive, and she was on several psychiatric medicines for depression, anxiety, and attention. Well, over time, we worked on healing her gut and weaning her off of those medications. And, years later now, she's a college graduate, and she's very active and attentive and happy. And it's sad to see that kind of thing can happen. It is,
a lot of kids.
It is, and I have, we've all in the health field seen those kind of things, but I think you have been really at the front line, and oftentimes, and usually traditional medicine doesn't recommend anything with diet, and that should be, I feel, a first defense to get the ball rolling. Let's see what can happen to the body and how good it can be. Just changing the diet, right?
Right. It's huge, and people have no idea how much it's impacting their health. Sometimes they have a sense of it, but really just surface so until they really are given the information and tools they need to start making those changes. And once they start to feel the difference, they are just usually astounded by it. Most medical programs, as we all know, get very, very little education on nutrition.
Yes.
And that really needs to be our focus.
Right. So, Laura, we're going to take a break right now. Can you hang on and come back in a few minutes?
Sure.
Thank you. I want to take this break right now just to discuss what you can do right now to start helping yourself with your diet. You can go to wellnesscenter.net and pick up my book, Revitalize Your Hormones. And even if you don't have if you don't think you have a hormonal problem, if you're eating foods that lack nutritional value, you are affecting your hormones in some way. You could be increasing estrogens, but just by the food that you're eating. You could be decreasing other hormones just by the food that you're eating. So by picking up that book, you'll get more ideas about a diet. And I think that's very important. Also, I want to recommend that when you go to drdaleswellnessstore.com, that you can also look at some of the nutritional products that I have. But one of the mistakes people make is that they take nutritional supplements and they think that's going to make the Big Mac go away, and it's just not going to happen. That's not going to make the fast food go away. So you have to do the whole thing in order to have a really healthy body. So the other thing you want to do when you go to the wellnesscenter.net or Dr. Dale's Wellness Store is you want to click on subscribe and subscribe to my free newsletter with educational information. So you just click on subscribe at the top of the website, and we will add your name and send you a free newsletter. So we also want to get some questions. And right now we're on Facebook Live. If you have any questions, just go ahead and note them, and I'll see if I can make sure that your question gets answered. So back to you, Laura.
Okay.
Hi.
Yeah. Hi. So you're right. And when you talk about how what you're eating can affect your hormones, and there's a lot of estrogen dominance happening, which a lot of that, again, goes along with that good microbiome. If you have more of the bad guys than the good guys in the gut, you're going to produce more of an enzyme called beta-glucuronidase, which is a big, long word. But basically, that means it's going to leave more estrogens that should have gotten out of the body recirculating in the body. So that healthy microbiome does play a huge role in how healthy your hormone balance is going to be, for sure.
And to get those good bacteria to increase, we need to eat healthy food. We also might want to consider adding some raw fermented cabbage or kimchi, and to have like a couple of tablespoons of that a day, or maybe even a tablespoon with each meal. It's a food. It's kimchi, it's raw sauerkraut, and having it fermented can really help the body. And so there's different ways to help that aren't going to cost you a fortune.
Right.
So
right.
when you're communicating and when you're dealing with your patients, Laura, when a person has a serious health issue that is pathogenic in its nature, tell me a little bit, and tell us all a little bit about how you would start helping them before diet. What other things do you recommend?
Before diet, we need to look at their stress level.
Right.
Stress is huge on its impact on the gut health and the hormone balance. But if there's something maybe I suspect pathogenic going on, then I'm going to want to do some testing. Say the person's working on their stress and they're eating healthy and they still don't feel well. It very well could be they have an underlying infection, other food intolerances, a parasite, yeast. It's really important to kind of investigate that whenever possible. Now, conventional testing, I think, misses a lot of that, so you need more specific functional testing to sometimes uncover those things when you feel like there's still a piece of that puzzle that's missing that you need to delve further into, and also just to make sure they don't have any major things going on as well. So we don't want to skirt by that either. But if they basically, it's the root of everything besides what you're putting in your mouth is your stress level.
Right.
So that's really impacting your health. And there's a lot of emotional baggage that people are carrying around either consciously or subconsciously that is blocking some of that healing process. So trying to uncover that can be a very vulnerable place for a patient. But at the same time, it can be quite an eye-opener that not realizing how much their stress level is impacting their health. And it's not something that just occurs overnight. It's something that's been occurring over often years before they get to the point where they start to pay attention of the impact it's having on their physical health.
And, thank you very much. And the other thing I was thinking is many times we have patients that have psychological issues or deemed bipolar, or they have, they're on psychological meds, they have psychological issues. And how do you feel about the way that is dealt with today?
Well, not great. I mean, because as long as all we're doing is medicating, but we're not finding what the root of the problem is. Mm-hmm. Yes, everybody has genetic weakness areas, but it takes a perfect storm to flip that switch. Mm-hmm. So how do we flip the switch back the other way to try to improve that person's mental health? So we need to look at stress, environment, nutrition. Or do they have nutritional deficiencies?
Right.
That because of the gut health, that's,
it could affect it. It could affect it as well. Yes. Yes. Mm-hmm. And so we just got a question from James, and James was wondering the name of the test that reflects the balance of bacteria in the gut.
Okay, well, there's 3 main tests that I know of out there that are doing that. One is GI map. Mm-hmm. Another is Biome, Biome. Mm-hmm. And there's another one called Ubiome, Ubiome. And that's where they're looking at the microbiome.
And I wonder what the accuracy of these tests are, or if there's any information, because I don't know how long the microbiome or microbiome has been available to people, and I hate to tell them to go get that.
Right. Right. It's as something that I've been trying to get clarification on myself. Mm-hmm. So I would just, if you're going to do any of those tests, go into them cautiously, because I think it's a new frontier.
It is a new frontier, and when you have new tests that are, you definitely want to find out the percentage of accuracy before you do it. Even blood testing, I use optimal reference ranges, but even saying that it's done on a day, and when it's done on a day, then in the blood testing, you could have stress that day. Something could have happened that day emotionally that could really skew the test results. I've seen that, I've seen a person who normally gets great blood chemistry panels, and they went in the day that something bad happened because they had an appointment, and it threw the whole thing off. So I think that's another thing to let people know.
Mm-hmm. Yeah, I think in the context of doing any kind of testing, it's just another tool in looking at the whole picture of things. Mm-hmm. And then you have to kind of put all that together and match it up with the story from the patient and what's going on, and determine from that a course of action, taking all of those things into consideration.
Wonderful. Well, I know that you really listen to people and that you are a gifted health provider. So I want to make sure that everyone has your number. So this is Laura Dankoff. Which number would you like them to have, and also your website?
Okay, my website is www.path, like walking down a path, PATH, to healthandhealing.com. And if you want to reach me by 719-966-7773.
That was not clear. Can you repeat that again? That was not clear.
Sure.
Yeah.
Yeah, the phone number is 719-966-7773, or you can email me at pathtohealthandhealing@gmail.com.
Wonderful. Well, thank you so much for your time, Laura, and for making this a beautiful show today. I really appreciate your being on, and so do all of the listeners. Thank you so much. And I'd love to have you come back sometime soon.
I'd love that. Thanks for having me today.
Thank you. Bye-bye now.
Bye.
Okay, well, you know a lot more now about your gut health, right? And what they call microbiome. So we just have to learn that is the good bacteria versus the bad bacteria. And obviously we want a lot more good bacteria. Otherwise, there's going to be a war in your intestines. That's not going to feel very good. So we want to make sure that you have the right information on your diet. And as we were talking about, all of the various things that you need to do, including, vegetables and fruit, all fresh and not much frozen or canned foods, if any. And just to make sure that you try to stay calm and have some tools that you can use, like meditation tools, to handle the stress as it comes up. If it comes up daily, you need to handle it daily. You can't wait a month, because then everything gets it compiles and it gets just more severe, and you start getting symptoms from it. So we want to avoid those symptoms. Anyway, a couple of things came up that I'm very, very interested in. And one of those things is looking at the different testing that's available today. One is called microbiome, one is called microbiome, but I'm not feeling that I have an accurate answer on that. Neither does Laura Dankoff on the 100% accuracy of the tests. And maybe it will be accurate 100% soon, but I don't know of any traditional medical test as far as blood testing or even for parasites, which is 100% accurate. I find that in parasite testing, I would say there's maybe a 40% to 30% chance of it being accurate. That's not very good. In other words, it can miss bugs that are in your body, right? It can miss parasites. And so we need to know that some labs are more accurate in parasite testing than others. And so if you go to thewellnesscenter.net and you click on products, at the end of that drop-down menu, you'll see order blood tests. Now, let me just tell you that is not a for-profit thing for me. Every time you order a test, I make a quarter, 25 cents. So I created this portal for you to order your own blood tests at 60% discounted prices. Okay, and I did this because it's the right thing to do, and I had the opportunity and met these people, and so I created discounts for everyone. They don't take insurance, but a $500 test is $97. Okay, that's 51 tests in blood chemistry. It's $97, and I would highly recommend that you, if you want to order this on your own, this is what it's for. You're in charge of your blood testing. You can read about all of the different tests, which test, would be the best for you would be decided by your knowledge of your symptoms. So if you have a lot of gut symptoms, then it'll you'll see the gut tests. I would suggest the blood chemistry. It's called Comprehensive Wellness Panel, and I would do that. And the thyroid panel is also very helpful. Hormone tests by blood is inaccurate because it tests the bound hormones. So a saliva test will test the free unbound hormones. So you want to have enough hormones to test, you see, and in blood testing, they're bound by protein, so they're not as available. That's why it's not accurate, but it's only for that. All of the other tests in the 51 test with the blood chemistry panel, $97, accurate, one of the best labs in the world, and I would highly recommend it. And this puts you in charge. You order the test, they send you give you information, they give you a requisition form, and then they tell you about a lab in your neighborhood that you can go and sit down with friendly nurses. All they want to do is take your blood. They smile at you. It's no negativity, and they take your blood and they send you the results, because you are the person that has to decide who you want to go to with that result, who you want to help you with reading the results. So I strongly recommend that you check that out, because there's even cancer tests, the CA25 test and other cancer tests are also available to you. All tests are available to you. Not only certain tests, because you're a consumer. So this is something that you need to know. You need to tell other people to know. You don't have to sign up on my website for this. You just need to go to products and drop down. You'll see order blood tests. You go to the page and you start reading about the tests. So what we have to do is to help one another, because life is interesting. The challenges come from our lack of knowledge about our body. The most important thing is the temple that you live in, the temple that you were given when you were born, okay? But it didn't come with a manual that says, here's how to operate it. The cheapest equipment today comes with a manual. You pick up a radio in the store, it comes with a manual. And yet the most precious thing in your life, other than the people you love, I'm saying your body, you couldn't love them if you didn't have a body and the soul that you are, right? That didn't come with a manual. Well, I'm part of that manual. You can consider me part of that manual, because I will always tell you what you can do, the least expensive way to do it, and I want to empower you to be the best that you can be. So I think that was our last question. We have about 12 more minutes to go. And I have a question from last week that I wanted to bring in today, because I know that you're listening. Oh, I'm getting more questions now. That's great. Last week, someone said, okay, they said, Dr. Dale, I've been on many hormones, bioidentical hormones, and what do I have to do now? I have a variety of symptoms. I don't know if it's caused from the hormones or not, but I need to know what I need to do in order to find out. So the best way to find out is to do a very accurate, I would say nearly 100% accurate saliva test. You can get that once you're a member of my wellness club. You can get the saliva test. It's a 5-element saliva test, and I developed this particular saliva test. We're testing the body 5 times according to the 5-element theory of Chinese medicine, and that also goes along with your and connects to your emotions. So that would be the thing to do, and then you would be able to, when you buy that saliva test, it includes a half-hour discussion with me after the results come in, so I can discuss and explain to you the saliva test and what you need to do to fix anything that is abnormal on the test, and how to do it, and including your diet. So you might want to take advantage of that, and then we will be helping you. And as a member, you can email me every day with questions, but you have to become a member first. And you can also set up an appointment with me there. So that was one of the questions, and I'm seeing that people have a lot of suggestions that they have learned a lot, and they're trying to help their family, and they're giving them suggestions, and oftentimes those suggestions are not fully appreciated. Like, mom or dad, I want to get them to eat better, and I'm making suggestions to them, and they're not following it. What do I do, Dr. Dale? Well, I mean, it's like, be patient. That's the thing that I've done. Be patient. Take a little bit at a time. Send them literature to read, simple literature to read, not an anatomy and physiology book, but a simple page or two of literature. Take it slow, take it easy, be patient, but be consistent and persistent. And you'll find that things start to open up a little bit. And that's what we can do. We can do the best that we possibly can, but we can't force our relatives, our parents, our loved ones. We can't force anyone to do something that they're resistant to. And so that resistance is showing you that you need to back off and you need to do it a different way. So I would strongly suggest that you check that out and see how that works for you. We have about 9 minutes left, and I do want to answer some of the questions that I'm seeing here. Let's see. Okay. You're understanding, let's see. You want to talk about an underactive thyroid. That's what you want. Oh, that's a good topic. One of my favorite topics. Let me tell you something. Your thyroid is affected by many things. There's many things that can make it dysfunctional. The most common thing is not what you think. It's not your genetics. It's the mercury fillings in your mouth. The mercury, it's in your mouth, and your thyroid is here. It's in your neck, and your brain is, of course, right here. When you consider the close proximity of everything, you have to understand that mercury fillings in your mouth is one of the most toxic things that you could ever have in your body. Those people who are trying to eat vegan, they're trying whole foods, natural foods, they're giving up all alcohol, they're doing all these things, but they still have mercury fillings in their mouth. I mean, that has to be replaced by non-toxic substances, okay? And what we need to do after we replace the mercury, it's proven that this affects the thyroid. Mercury also has been indicated as a cause of cancer. It affects neurology. It affects how our brain works, okay? And so when we have the mercury out, that's not enough. Now we have to detox it from the tissues, from the thyroid, from the brain, from the entire body. And in order to do that, you need two things. Now, you don't want to do this, you don't want to do all of these things before it's taken out. Right now, you could help the mercury to come out by using the slow cleanse that I have. That would be awesome. But after the mercury is out of your mouth, at that time, it's most appropriate to do the homeopathic mercury plus detox and the slow cleanse together. I mean, the mercury plus detox, I would like to see you do that after the mercury is replaced, along with the slow cleanse. But if you say, I'm not taking my mercury out, then I want you to come and see me. Because I want to show you all the documentation there is. You can go to my website and you can read some of my articles on it. And, it's also in my book, Revitalize Your Hormones. But you just go to toxicteeth.org, toxicteeth.org, and you'll read more about it. Now, the things you should not do if you have mercury in your mouth. It's soft in your mouth. It's not a hard substance. So that being in your mouth and being soft, okay, there are certain things that can pull it out of the teeth and make it go into your body more so than it normally is, and also go more so into your brain. So those things are chlorella and spirulina. If you take chlorella, it has an affinity for heavy metals, and it's going to move it out of your mouth a little bit more than it normally does, or a lot more than it normally does, and it's going to really toxify your blood and your body. If you take a metal teaspoon dry and you stick it into a bottle of chlorella, you will find that that metal teaspoon comes out with all this chlorella attached to it, because its job is to detoxify and get rid of heavy metals. And when it finds it in your mouth, it's going to move it through your body, and we don't like that. That is not the way we want to do it. So while you have heavy metals in your mouth, do not use chlorella or spirulina. You can save that for after the heavy metal is replaced, and you want to have it replaced with biocompatible fillings. So you get those from a biological dentist. A biological dentist. If you don't know one, a holistic dentist is not the same, but a biological dentist, you would go to HugginsHealingArts.com. Dr. Huggins is the inventor and trainer of a system whereby traditional dentists are trained and educated for years to become a biological dentist. You want to check that website out. They have a list of biological dentists. I would suggest you're calling them and finding out the best in your area. Okay, because they're all over the United States. We have only about 3 minutes left, and I want to thank you so much for being with me. I hope I answered your question about thyroid. Get your fillings out. If you don't have fillings, what you need to do is try some. You need to find out if you have Hashimoto's. If you have Hashimoto's, you should not take regular iodine because it's counterindicated. You could do ionic iodine, but you probably don't need iodine. If you have low thyroid, you need to take iodine. I make a product called bioiodine and nanoionic iodine. Read them both. If you have a severe thyroid problem and it's underactive, you want the bioiodine. Okay, if it's just a little bit irregular, you want the nanoionic iodine. If you're on meds and you want to get off of them and you have a thyroid, then you would have to see a health provider that can put you on the right amounts of iodines to help you wean off the amount that you're taking and slowly lower it. And you need to work with a traditional naturopath or naturopathic doctor or an integrative medical doctor or, some natural health provider and a chiropractor who can test you to find out maybe you're taking too much of the med, maybe you can cut down now with some iodine, with eliminating certain foods, okay, for your body. You need to be tested. See, that's what I do. I use more of the neurophysical testing because I know it's more accurate than any blood or saliva testing. But most doctors are not trained in this. However, they can be by going to traditionalnaturopathy.com, traditionalnaturopathy.com, and checking out the course on neuroendocrine and anti-aging regulation. I'm going to have some new videos up there and audios as well discussing the courses themselves. So we'll stay tuned for that. And I want to see you back next week. I love the questions. I think this is a great idea because then I can see you in the present. I can see exactly what you're talking about, and there's no delay in my getting back with you. Thank you so very much. Again, we're looking at wellnesscenter.net. My email is 88teresa@gmail.com. Please ask me a question there and I'll ask it next week. But as you're on each week, I can see your questions and address it immediately. Thank you so very much. Have a terrific week. Many blessings to you. Bye-bye for now.